Welcome, everybody. My name is Scott Jones. I'm a community health lead for Ivy Yard, and I'm joined by Dr. Sandra Nelson, an infectious disease physician at MGH. Dr. Nelson, I'm so happy you're here because I really have trouble making this mask fit, and I'm really hoping you can provide some advice.
Thanks, Scott. Thanks for asking. I will say that I've been wearing masks like this, surgical masks, just about every day for the last year. So I have learned a number of tricks to get the masks to fit a little bit more properly. A couple of thoughts. First, the most important thing is that you have a comfortable mask that you're going to wear, because if you don't wear it, it's not going to offer you any protection. Sometimes masks can be a little bit loose and they may need a little bit of adjustment. Let me just show you what I do. Here is a mask. I know that my face is a little bit small. So a conventional surgical mask doesn't always fit me correctly. You can see if I put it around like this, just kind of comes down a little bit. Masks here, you see this a lot on the streets, but that's not going to do anything to protect you against transmission. So a couple of tricks that you can do if you are like me and have a little bit of a smaller face. First of all, you can just twist the ear loops, and that gives it a little bit more of a snug fit, just like this. Twist and then behind. You've got to do two things though. You've got to pinch the nose, which you've got the wire bridge portion at the top, and then you've got to tuck in the sides so that they stay close and secure, fit to your face, just like this.
Awesome.
Like
Mind if I follow along, Dr. Nelson? I'll go ahead and sanitize my hands and follow along with you here. So I have my mask here.
Okay. So you may not need to actually loop it because it looks like it's fitting you pretty well.
Okay.
It's fitting up here at the top, right on the bridge of the nose. Just make sure you give it a good pinch. And I think you've got a good fit there. You may need to secure the sides a little bit, but it looks to me like that's fitting pretty well.
Awesome.
Can I show you one other strategy that I sometimes do if the mask especially is a little bit loose?
Yeah, please.
One other thing that you can do if you need a tighter mask is to actually tie the ear loops. So you tie the ear loops together close to the portion of the mask here. What you do is you fold it in half with a colored portion, the outside portion out, and then you tie some loops. I'm going to show you here. I've got this all tied and ready to go here, a little tie. And then you can just put on the mask like this. It gives you a little bit more of these wings at the side. And again, you just kind of tuck them in. You can either put it on in an inverted sort of way, or you can just tuck them in here. And this is great for people with smaller faces that need to get a secure fit here.
I think I have a pretty large face, so I'm going to stick with this fit, but that's good to know. So Dr. Nelson, I have to ask about safety. Is this really protecting me? How effective is this?
So it's a great question. And we know that a surgical mask that's worn properly is highly effective at protecting both the person who wears it, but also the people around you if you happen to be carrying COVID-19. We've been using these in the hospital for the last year, and I will say that transmissions in the setting of people wearing their masks is extremely rare. There's actually been a study that's looked at the efficiency of these masks with these little modifications. If both parties, you and me both, are wearing masks, we can actually reduce the exchange of particles by about 96%.
Awesome. So it sounds like the goal then is to prevent the infectious disease from getting out of the mask here, which really, I guess, underscores your earlier point about the proper fit.
Yeah, really what you're wanting to do is when I talk, if I don't have my mask on, I'm expelling viral particles. Or if I had COVID, I'd be expelling viral particles. Every time I speak, every time I breathe, coughing and sneezing. So the idea behind the mask is it will catch those particles. And say if I'm in person and I'm talking to you and you're a few feet away from me, I would be breathing in the particles that you're expelling as you talk or breathe or cough or sneeze. And if enough of those particles land in the sensitive parts of my mouth or my eyes or my nose, then I can get pretty sick.
Well, thank you so much. This has been really helpful. I feel like I learned some really good tips, and I feel more assured that this is actually a really effective practice. So thank you so much, Dr. Nelson.
You are welcome. Don't forget the hand sanitizer.
Oh, yes. Thank you. Thank you.